And I'm very happy to welcome you to our second webinar within the Alcohol Awareness Week, which is, as you know, a joint initiative that Eurocare has been organizing for some years now. And this year, it's in collaboration with the European Association for the Study of the Liver, the European Liver Patients Association, the European Brain Council, the European Federation of Addiction Societies, and the United European Gastroenterology. And in addition, we also have a number of other organizations supporting this initiative. And we are also happy that this year campaign has been organized in very close collaboration with the WHO Europe, specifically the alcohol team. So we are very, very grateful to WHO for being with us also today. So the aim of the week is, of course, we want to try and increase awareness of the need to address alcohol-related harm in Europe and highlight the need for an integrated approach to alcohol policy. And as you know, this is, as I said, the second webinar in a series of 3 that are planned. We had the first one yesterday, and the third one will be tomorrow. Today, we are looking closer to the link between alcohol and COVID-19, which is, of course, nothing more contemporary and relevant these days. I am just supposed to give you a brief introduction for the webinar today. I'm just going to say that COVID-19 has changed lots of things in our lives, including people's relationship with alcohol and the pattern of consumption that there seems to be. We have heard that alcohol has an impact on the way we can also protect ourselves from COVID-19. And I hope maybe we will talk about this also today. And then we know that while bars, restaurants, and pubs are closed in many places across Europe, we read also that some places alcohol consumption is going up, while the alcohol producers are reporting losses of sales. So we have this situation now. And some also report that the sales of alcohol in supermarkets have increased by between 10 and 15%. And people seems to be stocking up, spirits and wine and beers in preparation for being locked up, in their houses. And we're also witnessing things that we didn't before, like online aperos and quarantinis, which is a way to drink together online, and virtual happy hours are becoming more common. So this is what we are seeing these days. So we need to know really what is going on, especially because all this is happening on top of the fact that alcohol-related harm was, even before COVID, already very high in Europe. So it's an issue that I think we need to address. So I'm really looking forward to hearing our speakers today, because I think they will help us understand where we are, what we know so far about the relationship between alcohol and COVID-19, and maybe what can be foreseen for the future. And I'm also very happy that we have experiences from a number of countries which have done probably some good practices in terms of preventing the damages that alcohol can do in relation to COVID-19. So I'm going to give the floor to our list of speakers in a minute. I just need to give you some housekeeping rules. As I said yesterday, we are recording this webinar, and we are going to make it available on our websites and on YouTube. So if you don't want to have your name visible, you can click and rename so that you're not visible on the recording. And if the speakers agree, we will also put the PowerPoint presentations on the website. So you will be contacted by the Secretariat if you agree or not to have your presentations there. And yesterday in the chat, there were the possibility to put questions to the speakers. So if you want everybody to see your question, please write, making sure that you select all participants. Otherwise, just the speaker will see your question. And please stay muted, except of course the speakers while they're giving their presentations. So without any other delay, I'm very happy to give the floor to our first speaker, Carina Ferreira-Borges. She's working at the European Office for the Prevention and Control of NCDs at the WHO Regional Office for Europe. Thank you, Carina, for being with us today too, and looking forward to hearing your presentation.
Thank you very much, Tiziana. Thank you. Yes, so here we are today. So talking about alcohol and COVID-19, and it's a pleasure. And thank you again to Eurocare for inviting WHO to join this very important initiative. This is a very important week. It is really important that we increase the awareness on alcohol harm. And I'm very happy to be discussing here and presenting on alcohol and COVID-19. So next slide, please. As it was mentioned by Tiziana, I'm based in the European Office for Prevention and Control of NCDs. This office is basically tackling all the risk factors which are related to the heavy burden of NCDs in the European region. So we have been producing different documents which are related to the main risk factors, and this includes, of course, alcohol. So next slide. We know that alcohol is harmful, and it's not just about the effects on the health, but also its effects in other areas, such as, increasing inequalities. One of the main important commitments which were made by governments was to, following the Millennium Goals, was the Sustainable Development Goals. And I think we do not address them, and we do not talk enough about the development goals. When we look at the development goals, health is one of the goals, but there are many more. And what happens is that alcohol is, affecting the health goal, but also affecting other goals, development goals, which are part of that development agenda agreed by the presidents of many countries. And we know that alcohol will impact not just on the health, as I was saying, but in other SDGs, and will have also, as a consequence, will prevent countries from achieving many of the targets which have been set by the countries in terms of the Sustainable Development Goals. Next slide. If we look at per capita consumption among current drinkers in the European region, we understand that we have a huge problem. So Europe continues to be the region in the world which has the highest alcohol per capita consumption. So many of the countries in our region drink much more, and highest consumptions in the world. And we have here, as you can see, many countries where we have very high levels of per capita consumption among drinkers. So we also have the region where we have very heavy percentage of men, especially men and women, but men who have heavy episodic drinking. This is the most detrimental pattern of drinking, and it is important to look at the impact that this has, because many people, and we hear it, very often, it's about moderate consumption, people, should drink moderately. But what is moderate, right? When we see that almost half of the people in the European region drink in a very heavy way. So we we need to come back to these definitions. Next slide, please. If people drink a lot, this has implications. So we have been seeing in the European region that, drinking, as we are drinking, as people are drinking, is having a huge impact in terms of the mortality and in terms of, disability and years lived with disability. We know that any benefits which might be linked to the production and sale of alcoholic beverages will come to an enormous cost to the society. We know that about 1 million people die every year in our region. This is a huge amount of people. This is, impacting on the youngest generation, on the most productive generation, if we look at the proportion of those deaths in terms of, its distribution in the overall population. Next slide. If we talk about alcohol and COVID-19, well, I think the first thing we saw when we heard, when we started going home and, the lockdowns and all the changes that we had in our lives from March this year, we saw that there were a lot of things coming out in the news and a lot of misinformation. We also assisted, unfortunately, to many people dying because they were not informed or they were misinformed about the effects of alcohol consumption. We saw many people dying because, people were recommending them to drink because it would protect against COVID-19. And we heard that quite often, unfortunately, even at a higher level. Next slide, please. Because of that, WHO European Office decided to launch a campaign that would provide information. What is it that people needed to know related to alcohol and COVID-19? So we developed a package which basically consists in several publications, and I'll show you a little bit, that package. First of all, we developed a lot of awareness raising, on the issue of COVID-19. Just making sure that people would understand that alcohol would not be a good thing, to lead to help with their anxiety. That on contrary, alcohol would increase their anxiety because, alcohol is not a good substance when you're locked at home, to be, to control your stress. We also issued a communication strategy and a lot of infographics. These infographics were used by many countries, translated into many languages, and are still circulating among many of the European countries, even outside. We launched this campaign together with the EMRO region and with the PAHO region of WHO to ensure that all the regions of WHO were being covered because we saw the amount of deaths that were coming out from the misinformation. We also saw the impact of alcohol in terms of violence, people being at home and in terms of the violence. So these infographics that we launched also address that. Next slide, please. We also issued an infographic, a specific infographic, which was covering, main messages that we wanted to send out. First of all, that people should, avoid alcohol. That under no circumstances, anyone should drink any type of alcoholic product as a means of preventing or treating COVID-19 infections. The second thing we said was that alcohol consumption would not protect anyone from the COVID. It didn't matter that you would put one substance in your mouth and that substance had alcohol, and that it would be an alcoholic beverage, but that would not be a solution to protect you from the COVID-19. Because we saw that widely advertised by many economic producers as, a way out of the COVID. We mentioned that it would be important for people to avoid alcohol, to reach out for help, because we had people also that were struggling with dealing with their anxiety. So it was important for them to reach out for help, not to use alcohol as a way of dealing with the emotions, and especially also never mix, with medications, alcohol and medications and more medications. The other area which was also important was the children. we were having, everybody living in very small spaces, children exposed to alcohol drinking from the parents. So it was important both, to ensure that the children and young people, would not have access to alcohol, because we saw also many people taking alcohol, bringing it at home. And also to discuss the effects of alcohol risk-taking behavior. So this was an occasion also to discuss with our children, to discuss at home about, the risks of alcohol intakes, the risks for violence, the risks for, many of risk-taking behaviors. Next slide. We also issued a fact sheet. This fact sheet was traduced to many languages, Arabic, English, Spanish, there's Portuguese and Russian. And the fact sheet provides a very long list of information, but deals especially with myths and aims at, clarifying all the messages which are needed, which are scientific, and people need a source of scientific information, and the aim of this fact sheet was to provide that source. So alcohol, as being a harmful substance, has an effect in your body, and the risk that it has, to your health increases with the amount of alcohol that you're drinking. So coming back to the fact that it will not protect you because, as for COVID, and it will not be good for your health also, in any cases. But especially that alcohol, and in particular heavy use, has an impact in the immune system, reducing the ability of this system to cope with infectious diseases, including COVID-19. So this was an important message also to counteract those messages where you would be better, if you would drink alcohol, which was not the truth. Again, that alcohol use was a risk factor for acute respiratory distress syndrome, one of the most severe complications of COVID-19. And these are just some of the information which are portrayed in this fact sheet that we have issued. So next slide. We also issued a frequent asked questions fact sheet. So basically, what are other health and social risks related to alcohol and COVID? I mean, are there any particular threats to people who have alcohol dependence? All of this within the framework of the COVID-19, epidemics. How does alcohol affect the most vulnerable groups? Homeless people during the COVID. What can we do? What would be the responsibles that countries need to consider in dealing with COVID and, homeless people that have alcohol use disorders and will need to be supported during this time? So how would, what measures are needed to reduce consumption during the COVID-19? Again, how do we ensure that people go to treatment, continue their treatment, and have access if they want to reduce the quantity of alcohol that they are, taking? Next slide. So all of this was part of a package that we issued, and this package went out throughout the world. It was seen in the US. We even appeared in a very famous, program in the US, information program. And it was featured, in all the news, and we were very happy, to see that the main communication channels internationally were saying, okay, drinking alcohol does not, kill COVID. It increases the lockdown violence. I mean, it's not good for you to drink. So we were very happy to see this being taken up by the media. Next slide, please. So we also issued measures for governments and, important measures saying that, alcohol should not be considered as an essential item. There was all these discussions, what was it considered? And it's still going on, what are essential goods, what are not essential goods that you can get out of the house and go and buy. So that alcohol should not be considered an essential item, that provision of alcohol should not be designated as an essential service, and it should not be offered online or offline during the pandemic. So these were the recommendations, very clear recommendations that we have issued in WHO. Also, alcohol is not an ordinary commodity. It is a psychoactive substance. And therefore, with many people isolating, and working from home, everybody should be aware that being under lockdown with this kind of substance poses certain risks. So for government, this means additional measures, and these measures are needed, and they need to be part of the regulations and should be tight. So many of the best ways to reduce alcohol consumed in the society are linked to the WHO best buys. And we, again, called up upon governments to strengthen these regulations, increase alcohol taxation, restrict the access to retail alcoholic beverages, and introduce, comprehensive bans on alcohol advertising, promotion, and sponsorship that we saw coming up very strongly online. Next slide, please. We also mentioned that it was important to reduce the amount that a person could buy at a time, limiting hours of sales, banning home deliveries and alcohol sales over the internet, where there is no proper age verification that can be made. So this was also a very important recommendation that we made, that we maintain, that needs to be kept to avoid, the harm which is linked to alcohol consumption. In addition, we also suggested that governments may consider prevention campaigns on the risks of consumption during COVID-19, for the different populations group. And finally, that competent authorities should develop specific codes and apply the mechanisms which are needed to remove all the false information, especially on the social media, the fake news on alcohol and COVID, because this has already led to many deaths, and these deaths should be completely preventable. So the specific lessons learned from the pandemics should also include a careful re-examination of the role that alcohol plays in our social interrelationships and the ways of denormalizing alcohol use as part of our lives and our lifestyles. I think COVID-19 is an excellent opportunity also to revisit, these concepts and to revisit the policies and really give us lessons, on what we could learn more, of living with alcohol and what can be done at policy level. Because as we were discussing before this meeting happens, there was a lot that was done. There was a lot that we saw that we would not have seen out of the COVID-19 context that seemed to be impossible, but that we saw many governments, taking decisions, even economic operators doing quite a lot of things, which, like labeling, which was important and we had not seen before. So a great opportunity, to do more to prevent, to reduce alcohol consumption. So thank you very much. I think this is the last slide. Can you just make sure? I think this is it. Oh, just before I finish, an important call also made by our regional director. So there was a publication on the Lancet, talking about the risk factors for non-communicable diseases and how we see the heavy burden of non-communicable diseases very closely linked to the worst outcomes of the COVID-19 infections. So we know that, people with worst prognostic in terms of COVID-19 infection have also many of the NCDs, and this is linked to NCD risk factors. So I think with this, I would like to end here. Thank you very much.
Thank you, Carina, for your description of WHO work in regards to this subject. I do got a question from one of the participants, which asks, what are the routes of disseminations in the EU countries of the awareness materials, the package that you mentioned?
I mean, we can put it here in the website. If you go to WHO European Office, then you search for alcohol. So you just put WHO /Euro/alcohol, and you will find, there's a page on COVID-19 and alcohol. Everything is there, but we will try to put it on the web, on the chat now. Thank you.
Okay, thank you very much again. And I would like to go to our second speaker now. We heard yesterday also Jürgen Rehm, who works at the Center for Addiction and Mental Health in Canada, at the Institute of Mental Health Policy Research and Campbell Family Mental Health Research Institute. And Jürgen Rehm is going to talk us about what do we know about alcohol COVID-19 so far in the WHO European region. And he is, I think, presenting some results of a recent survey initiative. So Jürgen, the floor is yours. Thank you.
Thanks a lot, and thanks a lot for inviting me. It's always risky to present data in an ongoing crisis. And that's especially risky for alcohol, because usually what we do with alcohol, we actually triangulate the results of surveys with the sales data. And currently, the picture of the sales data is not that clear, given the different trends in supermarkets, in other sales, and the downward trend in bars, which have a different meaning for different countries. Nonetheless, I'll try to walk you through what we know and one specific survey. This is something I'm presenting for a large group. On the last slide, you see all the members of the group. There are more than 50 organizations and individuals from more than 30 countries. So alone reading them would take all of my 10 minutes. We will share our slides and you can, of course, see who all contributed. It's important, however, that a lot of the things and a lot of the lessons we've learned on COVID are actually have been done by groups, spontaneous groups. And this survey has been done spontaneously because the usual mechanisms to fund surveys take a year or two. And when we wanted to do the survey in March, and we would wait for a year to get some funding, even if you're successful, it would have been March 21, and that is not acceptable. So we need to come up with better ways also to do that. But the good thing is we've learned a lot on how to organize surveys just between the community of our network. We've already talked about Europe, and Carina has shown the numbers. In 2017, total ABC was 9.8 liters among European adults, and 62% of the people within the European region are current drinkers. Lifetime abstainers are about 1/4. 2 and 5 drinkers report heavy episodic drinking, especially for male. We've seen those numbers. And 1 in 10 deaths are attributable to alcohol in our region. And the overall sum is 1 million. I think it deserves re-mentioning. So what would be possible mechanisms how alcohol use could change during the COVID pandemic? First is a distress mechanism. Very simple. Alcohol use is a maladaptive coping strategy, but it is a coping strategy to manage psychological stress due to the pandemic. We've seen it in other natural crises. We've seen it during Katrina. We've seen it during the recession, that a lot of people who prior had been already drinking above a certain level were actually going to alcohol to cope with the problems. And there was a spike in alcohol use disorder, meaning in the highest end of the consumption. The second would be the availability affordability mechanism. Overall, there are reduced number of drinking occasions, and in daily life, for a lot of people, they had less chances to drink because a lot of the restaurants were closed, a lot of the bars were closed, there was shutdown, lockdowns, etc. Moreover, in some jurisdictions, alcohol became slightly more expensive and thus less affordable. So that would speak to lower prices for alcohol, lower consumption rates for alcohol. So what do we know from the survey? The group effort was led by Carolyn and Kilian, and I've already mentioned on the first slide. It was a cross-sectional online survey conducted between April and July. We had 21 countries in the first survey wave. By now, we have another wave in PAHO countries and ongoing efforts of WHO European region to look into and disseminate the survey to the eastern part, not only the EU, but also the eastern part. And but I will report mainly on the western. And we had an analytic sample of about 32,000 people when we exclude the past year abstainers. Because our main question was, did you increase or decrease your alcohol consumption? And if yes, why? And the hypothesis was the stress, etc. It's a convenience sample. It's an oversampling of women, middle-aged adults, and individuals with higher educational attainment. However, in our distribution of drinking patterns, with the audit C, we are comparable to other general population surveys with a slight tendency of heavy drinkers being overrepresented. So we had to apply survey weights and adjustments. So that is the audit C, which I spoke about. It has 3 items: drinking frequency, drinking quantity, and heavy episodic drinking occasions. And that gives you an aggregated consumption score. And we used it to have an aggregated consumption change score because we asked for changes in drinking frequency, changes in quantity, and changes in heavy episodic drinking occasions. This is the main result for Europe. As you see, there's a 0 line. Some people increased, some people decreased. And the mean of the score is below the 0, meaning that overall, for those 21 countries as a whole, after adjustment for all what we know, we have less drinking in Europe. And these are the countries. We have an overall decreasing consumption change score. We have no significant change in Ireland, and we have an increase in the UK. So this is the overall result. Now, what are the next steps? Well, first of all, when we talk about this, we have to talk about the study's limitations. This is a convenience sample with possible bias. We no longer have real representative samples in alcohol. This is gone for the last 30 years. We can have better and worse samples, but truly representative samples where you basically everybody in the whole population has a chance to participate no longer exist. We have only assisted devices with weighting, with getting, with doing probability in some parts of it. So we need to validate alcohol use, which we found, against purchases, household purchases, sales statistics, and the concordance of these data. So unfortunately, most countries currently have a mixed picture about those comparators. However, in the 5 countries we've done some of those cross-checking, we seem to be able to validate this overall downward trend. That doesn't mean that some of those 21 countries may have different trends. And Emanuele has already indicated to us that he sees good reason that the trend is different for Italy. So what did we learn? The overall alcohol consumption seems to decline during the first month in the COVID-19 pandemic in Europe. Vulnerable subpopulations, however, exist, and we saw that these subpopulations who are experiencing very much stress did actually increase their consumption. They were just not the majority in each country. The natural experiments provided by COVID-19 pandemic provides further support that alcohol consumption at the population level can be effectively reduced when its availability and affordability is further reduced. That is an important lesson. Unfortunately, a lot of countries did exactly the opposite. When they saw that the bars are out, they actually declared alcohol an essential good, and they allowed sales via the internet. They allowed restaurants in countries where restaurants were not allowed previously to deliver alcohol. They allowed that. So we have some of those tendencies which are going beyond this lesson, even though in the first few months it worked, despite some of those sales which have been made to save up. It would also allow us the analysis of many different natural experiments in different countries, because we can correlate that with different phases of the pandemic, with different phases on the lockdown in different countries. So a lot is to be learned. And the final one is, we should always, any data on surveys, we should validate, we should compare with sales. We should never preclude too early. We should tell the world, we should discuss the findings, but the final findings will only be available once we have all of the sales data in. And finally, I would like to acknowledge all of those people, believe me, without reading them. Thanks a lot.
Thank you. Thank you very much. We will have the time to read all the names later on. I have a question for you. And the question is there any relationship between observed consumption changes and COVID control policies?
Yes, very clearly there is. Let me start with the very easy, which is not a European experience. A number of countries actually banned alcohol, and they had spectacular decreases in violence. South Africa, some Indian states, Mexico, some smaller places in North America. So that is one clear COVID measure, which is leading to good results. The second, which we saw, is that we had clearly, of course, a lot of the acute effects of alcohol, alcohol poisoning rates, etc., going down during confinement. And that's true for almost any country which had confinement. A third one is that we have some preliminary results that those countries who after a while tried to loosen their restrictions on alcohol actually had increases in violence, especially in domestic violence. This is another COVID result, that once you allow a lot of alcohol into the households with giving up minimum prices, with giving up some of those restrictions, there seems to be increases in domestic violence. Again, these are puzzles. We have that in one region, another region, and it will take us another 5-6 months to actually analyze it all. But I wanted to show you where we stand and what we know at this point, clearly saying it's preliminary.
Thank you, and we look forward to seeing your results in the following months.
Thanks a lot, and I'm so sorry that, as a scientist, I'm always a little bit more cautious.
It's okay, I appreciate that. Thank you again. We need to move to our next speaker, Emanuele Scafato, who is representing the National Institute of Health in Italy, as well as the European Federation of Addiction Societies and the Italian Society of Alcohology. And he's going to speak about alcohol and post-COVID-19 era, preparedness and readiness for a renewed prevention. Emanuele, benvenuto.
Welcome, everybody. I'm trying to share my screen. Can you see it?
Yes.
It's okay?
I think so.
Okay. Thank you so much. I'm pleased to be here as a long-standing our promoter and partner since many years, since the beginning probably. And well, awareness today would mean many things. As an example, when COVID started, we were completely unaware of the impact that we would have suffered. And may I say that the impact of everyday management of healthcare and prevention is one among the still burdening problems in our everyday life. Most of the usual common activities aim at detect, prevent, respond, recover from all the acute and chronic disease collapsed, as daily reported by the media and by scientific literature, from which I will try to highlight some comments, forcing people into an experience of missed prevention opportunities into a blocked health system, ensuring for too many months the COVID case management as the main public health priority, endangering, however, the diagnosis, the controls, the screening of all the other chronic and acute conditions. And this is something that we need to deal with for a renewal of health service organization in the post-COVID era, but may I say also in between the waves of COVID epidemic, to facilitate and improve the access to a much more appropriate healthcare and addiction service treatment as a sensitive one, and mainly focusing on alcohol addiction. We are all aware that of the limits and the constraints of the national health system. We have 150 million of patients with chronic disease obliged to a sort of virtual standby in situation to cope with the urgency of COVID epidemics. And to restart, of course, the daily routine activities. In many countries, a major effort has been done to invest in prioritization or rationing of treatments, convert clinical spaces, invest in personal protection, disposal in staff, implementing also the use of digital or by phone solutions to avoid face-to-face interactions, and speed up some selected and feasible procedures. An overall effort has been done to restore the capacity to detect, prevent, restore, and recover from COVID, but having in mind that we need to recover also people from all the other chronic and acute ordinary disease. This is a report from the OECD, and that mentioned very clearly the barriers and facilitators in relationship with the adoption of new digital solutions to improve surveillance and care, ranging from culture and change and adoption of new technology to privacy and security legislation, not forgetting the coherent funding strategy. We cannot say that we were prepared to a pandemic. And a pandemic plan ready to give a quick and valid response was not in charge, as witnessed by the situation all over the world. The current problem of several lockdowns blowing the people's head is still a huge problem to be solved by meaning a day-by-day planning, where reorganizing and the organization is made difficult by the second wave of the pandemic, whose impact has been experienced particularly by the most vulnerable patients still waiting for the continuity of care and treatment of problematic mental health disorder and addictions. This patient experiences a disruptive interaction in the continuity of care due to closure or pauses of the specialistic treatment service due to lockdown. And as a matter of fact, alcohol and COVID is a case of care inequality. In the addiction field, the management of illegal drug patients led to rapid change in clinical routine in order to avoid the higher risk of the consequence of the decrease in illegal drug availability, to avoid withdrawal syndrome, by mean unusual larger take-home doses of methadone or reduced frequencies of supervised consumption. Very different has been, the different of the management of alcohol dependent, who often miss the opportunity for a correct pharmacological treatment and control of symptoms, such as craving and seeking for and not ensure continuity of care, aimed at providing psychological and motivational support during a period in which loneliness, lack of self-control, behavioral changes, influencing mental health, pressure by social dynamics, working and family condition push them into a new and realistic dimension where progress toward the final goal of abstinence were completely lost. In Italy, as an example, 42% of people declare to drink more during the start, from the start and during the lockdown, and evidence reported by several surveys as a trend for all the alcoholic beverages, not only in Italy, but all over Europe, as the sales statistics looks like to confirm. The sharp increase in e-commerce, home delivery, sales online, engaged people into a very new experience, pushing a lot of individuals forced to stay at home to try new way of purchasing alcoholic beverages to overcome the boredom. This was reported also in the magazine of the industry. And that's why when we were in April, I launched a sort of alert in which I said that there would be a warnings, a danger of a new wave of addiction in Europe. Having in mind we had more or less the same situation, I am afraid that several factors are still in place, combining a sustaining an harmful consumption at home by thousands of people, much more influenced by a long-lasting epic crisis. A period that needed, as Carina mentioned, to fight misinformation and infodemia has been crucial to provide people with valid arguments to avoid drinking or to not think that drinking was a good thing for their health. And this was pushed by the industry marketing and not responsible misleading social communication by them. A challenge that as a public health institution and organization, we did also in close networking with WHO Europe in translating and adapting also the materials and to try to widespread the information, correct the information by means of social media. That is the trap of people literacy. How to prevent new stigmatization in patients already in troubles. For sure, implementing or relying on the delivery of treatments that are proved to be effective, avoiding self-references, overcoming a professional culture not based on continuous medical training, and early identification of alcohol risk in all of the health strategies. There are short-term needs to be tackled during the outbreaks by means facilitators such as telemedicine and digital solution, and don't care why long-term measures are needed to cope and to improve the future healthcare settings once free from COVID-19 epidemic. Some new pillars are needed, as mentioned in the main paper that I'm honored to share with other colleagues, and that was recently published. Starting from digital solution, all together with a person-centered care, valuing the concept of empowerment of people and their right to the highest possible level of health protection, there is the need for incentives to make a change in the clinical routine activities, investing in professional training, as well as much more integrated care, to value all the competencies, such as those from psychiatric and the addiction services. Revise some investing in the capacity building around a common added value, the renewal of treatment systems supported by technology and specialists to ensure equity and health opportunities, reducing the stigma by people that they have the right to seek and find appropriate treatment and contribute themselves to their own process of prevention and salutogenesis. It's nothing easy, I understand, but it's a challenge. We say nil difficile volenti, nothing is difficult for those who have the willingness to change. Gandhi said that the true nature of any society can be found in how it treats its most vulnerable members. This might not change, but we must change. And may I add that failure is not an option. Thank you so much.
Thank you, Emanuele. Failure is never an option for you.
Never.
I know. So thank you. Thanks for mentioning two things that struck me, that alcohol is a case of care inequality, and that we need to fight the fake news on alcohol and the fake news on alcohol and COVID also. So thanks for your presentation. And I'm moving quickly to our next speaker, Nick Sharon from the European Association of the Study of the Liver. And he will tell us about alcohol and COVID-19 and harms to the liver. Thank you, Nick. And the floor is yours.
Thanks very much, Tiziana. I can get my slides to move. Okay, so this is the first thing, and this is just to tell you that liver disease is one of the diseases which is at risk as far as patients with COVID are concerned. This is the first meta-analysis from July of this year, 25,000 COVID patients, of whom 3 had evidence of chronic liver disease. And the bottom line is that if you have chronic liver disease, it's significantly associated with more severe COVID infection, and it's significantly associated with an increased mortality from COVID. And just a couple of those studies. This is a study of nearly 800 chronic liver disease patients, multi-center study, disease registry study. And this is just showing you that the severity of liver disease is directly related to death from COVID. So this is child's grade A. This is a grade of severity of cirrhosis. And you can see with the most severe cirrhosis, you have an odds ratio of more than 9 for dying from COVID. And interestingly, alcohol-related liver disease is a separate risk factor for increased mortality from COVID. This is another study. This is patients with fatty liver disease who don't have cirrhosis. Obviously, we already know that obesity is a very important risk factor for severe COVID and for death from COVID. And this study suggests that at least in patients in this age group, if you have evidence of fatty liver disease on CT, that also increases your mortality after correcting for the degree of overweight. Although interestingly, we don't know if this fatty liver disease is obesity related or alcohol related, because no data on alcohol consumption were given in this study. So the conclusion from these studies is that underlying liver disease increases the risk of severe COVID infection. It increases your risk of death, and more severe liver disease, more severe risk. And alcohol and obesity are separate risk factors. And I haven't gone into the unquantified impacts on liver care and liver surveillance. So this is surveillance for portal hypertension and varices, and surveillance for liver cancer, all of which will have been affected by the impact on health services. It's worth adding at this stage that the development of liver cirrhosis is a completely silent phenomenon. People don't know that they're developing cirrhosis, and when we look at people admitted to hospital for the very first time with liver cirrhosis, then 75% of those they weren't aware they had cirrhosis up until that first emergency admission. So we estimate that more than 3/4 of people alive now in the UK with cirrhosis have no idea that they have cirrhosis. I just want to talk about some data that we have at Public Health England. So this is just an overview of trends in liver mortality in the European WHO region. And what we've done here is we've split countries into 5 groups, and we have countries like Norway and Sweden, which have always had very, very low levels of liver mortality. And you have countries like the Mediterranean countries, France, Spain, Italy, which used to have very high levels of liver mortality, but liver mortality has dropped because they're drinking less wine, less cheap wine actually. And then you have countries like the UK and Finland, where liver mortality used to be very low and is now going up. And then the Eastern European, the Eastern WHO bloc, where you have very high levels and often increasing levels of liver mortality. And practically all of these trends and differences are driven by alcohol consumption, differences in alcohol consumption. And it's worth noting that for my UK patients, at least, the vast majority of this alcohol is drunk at home because it's so much cheaper. Less than 5% of my cirrhotic patients buy their cirrhotic livers in a pub. So what I'd like to do is show you some consumption data, and this is all off sales data. It doesn't include any consumption in bars and pubs. It's from Kantar, and this is based on 30,000 households who scan their grocery purchases. And this is data that was commissioned by Public Health England to study the impact of COVID. And here we have 2 Christmases, and the coloured lines are the different quintiles of alcohol consumption. So you've got the highest quintile and then the lower quintiles, different colours. And what you can see are the 2 Christmases, and then you can see COVID. And essentially what we're seeing post-COVID is alcohol consumption at home increasing to round about Christmas levels. This is a Christmas that has been going on for 10 months so far. This is just to confirm what we've always known about alcohol. It obeys the Pareto principle. 22% of consumers drink or purchase 72% of the alcohol. And then just looking at those heavy consumers. So what I've illustrated here is the centile from 90 to 95%. So these are heavy regular drinkers who probably aren't in the alcohol dependency category. And you can see there that the highest component of consumption is wine, followed by spirits, followed by beer and lager. And again, you have the Christmas peaks there, and you can see that actually for this group, there's a 73% increase in purchasing for wine, that is post COVID. And this change in behavior is still present. So this is our latest data from October, and you can see that sales of alcohol are increased compared with the previous year, and they're increased by 21 to 28% compared to 2019. So this increase in purchasing of cheap alcohol drunk at home has gone on post-lockdown. Lockdown had finished by October in the UK, and yet the increased purchasing of alcohol was still there, very much a factor. And then finally, I've just got a slide because we do have some data from the impact on liver mortality, and interestingly, this data comes from Scotland, and this is pre-COVID, and this is just an illustration. We have liver deaths at the top, the waggly red line, and then we have alcohol F10, which is alcohol dependency and heavy alcohol use deaths, which is the lower line. And then I've plotted the 95% confidence intervals around those quarterly death figures. And this doesn't have the COVID data. This does have the data post the introduction of minimum unit price in 2018. And you can see a significant decrease in liver deaths and a significant decrease in F10 alcohol-related deaths with the 95% prediction intervals there. We've got 2 data points post-COVID, and you can see that for both deaths, liver deaths and F10 alcohol deaths, we're now seeing an increase in mortality. And we're seeing an increase, in fact, as far as liver disease is concerned, to levels equivalent to those that we were seeing before minimum unit pricing. Which brings us to a sort of a conclusion which I hadn't thought about really, which is that it may well be that the increased COVID deaths are going to interfere with our ability to examine the impact of MUP. Now, these increased deaths are likely to be a direct result of COVID on the underlying liver disease, increasing mortality. It's too early to say at this stage whether the increase in alcohol consumption will lead to a prolonged increase in liver mortality and alcohol-related mortality, but I'm afraid that seems quite likely, and I'm going to stop at that point. Thanks very much.
Thank you. Thanks, Nick, very much for sharing this information and your perspective as a liver doctor on what's going on now. We need to move fast now to the last session of our webinar, which is actual experiences from member states, state actions to prevent the spread of COVID-19. And we have 3 examples today, Belgium, Estonia, and Scotland. So I would give the floor to Mathieu Capunet for the description of what has been done in Belgium. Please.
Okay, thanks a lot for the floor, and yeah, thank you for inviting me. I'll try now to share the screen. I hope you will see it.
Yes, we do.
Okay, that's not the right slide. I have a slide before that. Okay, let's try it again. Okay, so perhaps very briefly, the situation in Belgium with COVID is quite difficult. You can see here the evolution of the numbers of beds in hospital occupied by COVID patients. So during the first wave, we reached nearly 6,000 patients in hospitals beginning of April, and this was considered to be the first wave. And then it decreased until the summer, goes up a bit in August, but really slow. I mean, not so high. And now we are in a real second wave, which is, as you can see, much higher than the first wave. So we were enabled in Belgium to manage this second wave, even with the experience of the first one, as the peak in hospitalization reached more than 7,000 people beginning of this month. The red data is about patients in IQ. So you see that we reached 1,200 patients in IQ in April, and now we have more than 1,400. So in fact, if you see the data of dead people per capita, Belgium is the worst country in the world. We have now more than 1,200 dead people per million in Belgium. So if you compare that to Spain or Italy or the United States or Brazil, which are in the medias, the countries that are most often considered to be the countries the most touched by the COVID. In fact, Belgium is sometimes 2 or 3 times higher in terms of death per capita. So yeah, not really a good situation in Belgium. So in terms of political decisions, I think as most of the European countries, in spring we had a total lockdown with a full closures of shops and a full closures of hospitality sectors. Only food and supermarket shops were still open, and there was a total ban of contact during spring. Now we are having again a lockdown, which is a bit less harsh. So there are a bit more shops that are open, but still we still have a total ban of the hospitality sector. So all pubs, bars, and restaurants are closed at this stage. And another measure that we have now is that the sale of alcohol is currently banned between 8 p.m. and 5 a.m. in the morning, even if shops can be open, or that you can still go to the restaurant to take food until 10 a.m. Alcohol is banned from 8 a.m. So the restrictions on alcohol are even stricter than for food. So there is a very important decrease in, you see a very important decrease, in fact, in alcohol availability in Belgium during the first wave, but also here during this second wave. Our Public Health Institute have done during the first wave a survey on the way Belgians were feeling about the lockdown and their health habits during that period. And for alcohol, there are few results that can be interesting to share. So among alcohol drinkers, 22% of consumers declared that they were drinking less alcohol during the first lockdown. But also there were 20% of people that were declaring that they are drinking more. But all globally, our Public Health Institute is concluding that there is probably a global effect that is going towards a reduction in alcohol consumption, and especially with young people between 18 and 24 years old. But I mean, again, that is kind of preliminary results, and we will have to analyze that in more detail, certainly with the sale data, as Jürgen have told us before. And perhaps also information that can be interesting is to compare the alcohol results in this survey with other products like tobacco, tranquilizers, and sleeping pills. And there, the conclusion of our Public Health Institute is relatively clear that tobacco, tranquilizers, and sleeping pills are more consumed during this first lockdown. So we see a difference here between alcohols and these products. So that's the situation in Belgium. We hope we will get out of it relatively quickly, but we know from the first wave that we will still have to wait for long months before being able to get out of this second wave. I will not speak more, as I know colleagues have also need to intervene. Thank you.
Thanks very much, Mathieu, for your very brief but also very clear description of the situation in Belgium. And now we go to Estonia, and we give the floor to Trinu Tat, telling us what's happening there.
Okay. Hello, thank you, Tiziana.
Hi.
Yeah, it's the first time I've invited 80 people in my living room. So COVID makes us do extraordinary things. And it makes some people to drink more, but also others to drink less. So the big question is which trend is more prevalent? In Estonian case, I didn't make slides because I promised to make it brief, and therefore I try to limit myself. In Estonia, firstly, let me say about the COVID situation. I think so far we have escaped a little bit lighter than some other countries. We still have, together with the spring first and second wave, we still have less than 100 dead people. I mean, all together. We don't have very strong restrictions, but of course the world closed down for us as well, and we couldn't stay as open. And that was particularly noticeable in spring, when even without official restrictions, the life really paced down significantly. No traffic jams I mean, and you could really see it in the nature that everybody was really slowing down their lives, and places went closed down. So officially, the government introduced the restrictions for alcohol from 10 to 10 p.m. until 10 a.m. And it's the same timeline what we already have always had this off-premise night sales ban. And then it was extended to bars and restaurants. And I would say it didn't matter so much because people in the spring, because people did not really hurry to the restaurants and bars in the spring, because nobody really knew what the situation was. And nobody went to restaurants anywhere, and so many places were just closed down. This autumn, we have another ban from midnight until 10 o'clock. And that was already met with much more resistance. Like nightclubs and bars were fighting for their survival, but it was introduced from 25th of October, and it lasts till the end of January. So, but how has it really influenced and impacted our drinking culture? I would say that it's twofold. Some people definitely drink less, particularly young people, because they wouldn't care. They're not dependent on alcohol. They are longing for the social life, and but there are quite a lot of people for whom alcohol is a goal in their selves. So we don't have good questionnaire data. We tried to participate, but unfortunately didn't get enough respondents. So we will know on next spring when we have consumption data and mortality data. We do see the increase in domestic violence, but it's more about anecdotal evidence. I just happen to know that the child protection homes and these protection shelters for children and women, they're full. But when you look at the police statistics, you can't see this domestic violence increase. So there's some discrepancy, clearly. And then I would also like to bring up that in Estonian case, there's also another very important factor besides availability, besides closing down shops and bars and restaurants. It's cross-border trade. For years, I've been going to one alcohol event to another, telling the sad story how we cannot really increase taxes or implement a very strong alcohol policy, because if we do, our people go to the neighbors to shop for cheap alcohol, and we saw it from 2017 until today. And now with the COVID, the borders were closed. So we do hope some positive impact of closing borders to the domestic drinking as well. But we'll see the result in the spring, and I would like to say that this COVID time is really very interesting. In one hand, devastating, but also very interesting for somebody in alcohol policy, because I mean, you can't have a discussion about alcohol policy at the moment because COVID takes priority everywhere. But at the same time, so much is done, so much measures are implemented. So this is a kind of natural experiment for us. We can really see and then show to other people what it means if people cannot go to shop for cheap alcohol, what it means if bars and restaurants are closed at night. So I say has been difficult time, but it's also a time for opportunity. Yeah.
Thank you, Trina. We are a little bit late, so I'm asking all panelists and participants if they have probably 5 more minutes of patience, because we still have one example from Scotland, and I'm giving the floor to Graeme Callender to speak about what is going on in Scotland.
Thank you.
There you go.
Good afternoon. I'll try to keep this very brief. I know you said 5 minutes, maybe 15 minutes by the time I finish talking. So I suppose really just very quickly, just to say that I am the policy lead for the alcohol support, treatment and recovery for the Scottish Government. And today I would just like to sort of share some of the approaches that we've taken in Scotland in relation to COVID and alcohol. Obviously, like many countries, there has been obviously a whole population approach to COVID itself, with lots of daily briefings from our leaders and test and protect sort of contact tracing systems put in place, alongside very specific sector guidance about workplaces and about some of our health settings. And I think it's just important just to mention that. However, in relation to the work within alcohol and drugs, our approaches probably could be summarised into 4 key areas. And really that is around communication, which is around clear, frequent communication from Scottish Government out to our stakeholders within the community. Also, as well, it's around guidance, around the development of specific guidance to allow for, for specific bits of support to continue, which I think is really important. Also, as well, I think we in terms of an approach, we looked at enhanced delivery, and I think that's about trying to increase the capacity within the system wherever possible. And lastly, it's about exploring new ways of working and trying to bring in sort of new approaches in terms of how we have been working in terms of how we used to work. Next slide, please. Thank you. Okay, and just in a little bit more detail, and although communication is crucial at any time, I would say that it's none more so than during the pandemic and during what is also a public health emergency. And within Scotland, we're also dealing with a drug deaths crisis, as well as very high levels of alcohol-related deaths prior to COVID even sort of happening and taking place. But also what's really important about communication is about there is lots of competing voices with different sectors asking for support. And the role that I have within Scottish Government is to ensure that alcohol support services and the general health messaging around alcohol is being heard. So I think from the beginning of the pandemic, in terms of that specific approach, we have made a concerted effort to increase contact with our national and local stakeholders through, whether that's through increased reporting requirements, increased sort of meetings with stakeholders, providing newsletters, but I think also as well as seeking out good practice and sharing within the community, as well as asking and gathering intelligence, because I think there's one thing for government to try and understand what's happening, but I think it's really important to see the impact of COVID, particularly around support and treatment services, that getting that directly from service providers. Also, as well, I think as Scottish Government recognised very early doors that we provided some additional resource around our NHS Inform web pages, which is to ensure that those key harm reduction messages around alcohol and that key information was still getting out. And as many of the previous speakers have mentioned, is that alcohol use it seems to be on the increase, particularly that home drinking. On top of that, I think what's also really important is that the role of Scottish Government has been to provide specific guidance. And I think at the very beginning of lockdown restrictions in Scotland, what we saw was there was a shift of some resources from alcohol treatment services into COVID-specific responses within the health service. And very quickly, our Minister and our Chief Medical Officer wrote out to all of the local authorities and health boards not to redeploy their staff or reduce capacity. And I would say that overall, I think that has had an impact of not seeing a redeployment of services or staff. Also as well, we worked with some of our national commission charitable organisations like SHAP and Alcohol Focus Scotland to produce some specific guidance. And I think I've mentioned it here in the slide, which is around home detox guidance, which was in direct response to some of that early sort of redeployment of resource away from alcohol inpatient beds to allow people to make some safe sort of kind of decisions at home if they were struggling around their alcohol. But also as well, the mutual aid and sort of self-directed support guidance, which was to allow support groups to continue, which we know is incredibly important during the pandemic. Also as well, I think we were very keen to ensure that there was enhanced delivery wherever we could increase capacity. So making sure that access to our drink line and web chat services were increased so that people were able to pick up the phone for support or chat online should people be struggling around their alcohol. And also we saw a big uptake in digital interventions and digital access. So the NHS had Attend Anywhere software, as well as Scottish Government providing some additional resource for people to purchase phones, purchase tablets, and get broadband so that people, particularly through a recovery community, so that people could get access. And like many countries, I think that the government tried to make as much additional funding available for any charities or community services that had been adversely impacted as a result of lockdown. And I know I'm very sort of stuck for time here, but very, very quickly, in terms of some of the new ways of working, we're very able to look at some of new ways, which was to introduce our prisons to rehab pathway work, which was allowing prisoners to directly access residential rehab to continue their sort of recovery journey, as well as some of the approaches around homeless support, where making sure that people were taken or provided accommodation off the street and with lots of services being wrapped around there, including, you know, sort of support alcohol treatment services as well. So yeah, so probably I could go on all day, but I won't do that for everyone. But that's just a very sort of quick example of some of the approaches that have been adopted in Scotland. Thank you.
Thank you, Graham. Thanks very much for describing your work there in Scotland in these difficult times. So I don't think I see any last questions in the chat. I see comments and thanks for from the participants. So I am supposed to draw some conclusions at the end of this webinar. It's not easy to draw conclusions. I think this is an issue that we really need to develop and to deal in a more deep way. We are all, I mean, as I think Jürgen said at the beginning, I mean, we are speaking about something that we are, you know, living every day. So it's really difficult for me to give you some, you know, conclusive messages. I think what came in terms of awareness, I think, and what is important for us to highlight is that at least one message we could deliver today is that it's clear that people are looking for ways to cope with this difficult situation. Nevertheless, our message, I think, should be that alcohol should not be used as a coping mechanism under any circumstances. And we have heard that from WHO recommendations. And that's maybe the only conclusions that I would draw today. And I think we have to help people understand that there are other ways to cope with these difficult times we're living in. And as I said before, regarding the relationship between alcohol and COVID-19, I think we need to get more information, more surveys, more studies in order to really understand what is going on in terms of alcohol consumption and alcohol sales and the whole picture needs really to be more clear than it seems to be today. So I'll just close the meeting by thanking very, very much all our speakers for taking the time and preparing their presentations for us today. Thanks for the participants. We're happy that we have also today, as yesterday, a good number of people joining us. So thank you very much. And I wish you all to stay healthy and safe, and hope to see you tomorrow for the third webinar, but also for the next year Alcohol Awareness Week in November 2021. Thank you very much and have a nice evening.
Bye.
Bye.